Hello, everyone. I am Congresswoman Rosa DeLauro. I want to take a moment to tell you about our efforts for healthcare reform in Congress right now. Thank you to 21st Century Conversations and the One World Progressive Institute for offering me a chance to say a few words. After many months of hard work, we are on the precipice of a goal that has eluded us for over a century, ensuring that all Americans have access to quality, affordable health care, and that no one will ever be forced to go broke just because they got sick. One of the main reasons, if not the main reason, we originally took up this fight was to put a stop to the spiraling cost of health insurance premiums for American families. In the last 8 years, the average family premium here in Connecticut has gone up 87%. These surging health care costs have been bankrupting American families, and if left unattended, they will bankrupt our nation. That is why we have acted. Our health reforms slow the growth of these surging costs for families, businesses, and government. They provide security and stability to those with health insurance, and they provide insurance to those who cannot currently afford it. Under our plan, insurance companies can no longer deny you coverage or raise rates because of a pre-existing condition. And they cannot drop your coverage if you happen to get sick. Also, there will be no more lifetime or annual caps on benefits like the ones insurance companies impose now. So people are not bankrupted by health care. Instead, we will finally rein in the insurance companies and force them to compete rather than collude with each other. One of the aspects of our plan I am most excited about is that it finally puts women's health on an equal footing with men. With these reforms, insurers will no longer be able to charge women up to 48% more for the same coverage that men receive. And important preventive services like mammograms, maternity care, and baby checkups will finally be covered. Seniors in the Medicare program will also have access to important preventive services like cancer and diabetes screenings. They are free of charge, no more copays or deductibles. Our plan will also make prescription drugs much more affordable by closing the so-called donut hole. It reduces overpayments to private plans, it clamps down on fraud and abuse, and it extends the life of the Medicare Trust Fund. So our health reforms will do a lot of good for a lot of people, all the while working to reduce the costs of health insurance for all American families. With this legislation, we have begun to wrest power away from insurance company bureaucrats and give it back to people and their doctors. I am proud to have fought for it, and I look forward to it becoming law.
Here is the update on healthcare reform in 2010. March 21, 2010 was indeed a Super Bowl Sunday for healthcare reform. Members of the House of Representatives voted to pass the President's healthcare reform plan strictly along party lines as follows. This is considered to be the most important piece of social legislation since the Social Security Act passed in 1935 and Medicare became law in 1965. The Senate had already passed its version of the reform plan on December 24, 2009. It was the first time since 1895 that a Sunday vote had been taken in the U.S. legislature. Here is a record of that vote. Various amendments were passed March 23rd to March 26th to address the differences in both bills. Get the most accurate information about what this reform bill contains by visiting the following sites. Putting Americans in control of their health care from the White House's website. Take a few minutes to find out what health insurance reform will mean for you and your family. At the site, you will see a list of headings. Select which one describes your situation, and you will get a comprehensive explanation. Visit www.whitehouse.gov/health reform. Also, frequently asked questions about health insurance reform, the exchange, and other topics at www.whitehouse.gov/realitycheck/FAQ. For a comprehensive explanation about a broad range of health reform issues, including the insurance exchange, health reform implementation timeline, a summary of coverage provisions in the Patient Protection and Affordable Care Act, and the Healthcare and Education Reconciliation Act of 2010, and a summary of new health reform law, visit the Kaiser Family Foundation's website at www.kff.org. At One World, we firmly believe that knowledge is power. We encourage people to become accurately informed. We are providing a cross-section of websites, including the National Association of Insurance Commissioners at www.naic.org. They address a range of consumer questions. On March 23, 2010, President Barack Obama signed the Patient Protection and Affordable Care Act into law. Seniors, your Medicare benefits will not be cut under the new law. No, the Patient Protection and Affordable Care Act does not eliminate or reduce benefits provided under Medicare. Please also visit the U.S. Department of Health and Human Services website at www.healthreform.gov. Visit www.oneworldpi.org in the Healthcare Reform section for a comprehensive list of resources and much more detailed information. Our Reform Education series is available on DVDs through our web store. One World is committed to keeping the community informed about healthcare issues. The first aspects of President Obama's healthcare reform program went into effect on September 1st. You can learn more about these key aspects by visiting the web address on the screen.